Hello, what's going on, Grecians? This is the Scientific Mind with Sir Eman. Last week, we discussed the two important organ systems in the human body, the circulatory system and the respiratory system. As well as, I also tasked you with answering worksheets and activities. And I also think that you already received your check outputs. If you have any clarification in one of those items or questions, you can visit the LMS Science Class 9 and download the answer key for those worksheets. So for today's episode, we will be discussing topics related to the two systems I have mentioned earlier. Before that, let's have our prayer first. This episode is divided into two parts: the cardiovascular and respiratory diseases and how to take care of them. For part 1, we will be discussing about the diseases of the cardiovascular and respiratory system. Cardiovascular diseases are the general terms for conditions affecting the heart, blood, and blood vessels. These diseases belong to the top 5 leading causes of mortality or death in the country. The common cardiovascular diseases in the Philippines are angina pectoris, atherosclerosis, stroke, anemia, leukemia, hypertension, myocardial infarction, and valvular heart disease. These are the 8 cardiovascular diseases that we will be discussing in this episode. So let's start with angina pectoris. Angina pectoris is a chest pain similar to a heart attack, except for that it is mild. So we can say that angina pectoris is a mild heart attack. The pain happens during muscle exertion, starts from the heart to the left arm and shoulder. Then why is this pain located in this part of the chest? If you still remember from the previous episode, it is in this part that the heart is located, in the center of the chest, slightly pointing to the left side. Why this pain occurs? This happens when one or more of the heart arteries are narrowed or blocked, and it could mean that there is an adequate supply of oxygen in the heart. The next is atherosclerosis. Atherosclerosis is caused by the accumulation of fatty substances and cholesterol in the arteries. This buildup of fatty substances may result in vascular resistance and decreased blood flow. This will restrict blood flow, which may lead to the blood vessel burst because of the pressure buildup. The third one is the stroke. This may be caused by a blood clot on the blood vessels of the brain or by atherosclerosis. Its effect on the body depends on the degree and point of damage in the brain. Symptoms of stroke is headache. Stroke happens when there is an insufficient amount of oxygen in the brain due to the blockage of blood flow towards the brain. Reason for this may be a blood clot in one of the arteries or veins toward the brain or by atherosclerosis. Next to stroke is the anemia. Anemia is a condition in which you lack healthy red blood cells to carry adequate oxygen to your body's tissue. Thus, this will make you tired and weak. Symptoms of having anemia include fatigue, pale skin, irregular heartbeat, chest pain, dizziness, cold feet and hands, and headache. Next is leukemia. Leukemia is a blood cancer caused by a rise in the number of white blood cells in your body. The production of white blood cells becomes uncontrollable and increases in the number than the red blood cells. Until now, there is no known cure for leukemia. Symptoms of having leukemia includes fever, weakness, frequent infections, weight loss, easy bleeding, and bone pain. Next is hypertension, also known as high blood pressure. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated that leads from the diet high in salt, fat, or cholesterol. Second to the last of the 8 cardiovascular diseases, the Philippines is myocardial infarction, also known as heart attack. It is caused by insufficient blood supply to one or more parts of the heart muscles, which results to the death of the cell. One of the reasons why cell dies is because of lack of blood supply that carries oxygen. Oxygen is vital for cells to function normally. A heart attack occurs when one or more of the heart's coronary arteries is blocked suddenly or has extremely slow blood flow. Symptoms include pain at the center of the chest radiating towards the shoulder, left arm, and jaw. Another symptoms may be the feeling of impending death. The last cardiovascular diseases that is common in the Philippines is valvular heart disease. Valvular heart disease is caused by damage in one of the 4 heart valves. Hardened valves prevent blood flow by failing to open fully or close completely. Signs or symptoms of having a valvular heart disease is shortness of breath, wheezing, swelling of feet and hands, palpitation, fatigue, and rapid weight gain. Now that we have discussed the common cardiovascular diseases in the Philippines, let's proceed to the respiratory diseases. Respiratory diseases are pathological conditions affecting the organs and tissues that make gas exchange difficult in air breathing. Respiratory diseases is a type of disease that affects the lungs and other parts of the respiratory system. Respiratory diseases may be caused by infection, by smoking tobacco, or by breathing in secondhand tobacco smoke, radon, asbestos, or other forms of air pollution. Respiratory diseases include asthma, chronic obstructive pulmonary disease or COPD, pulmonary fibrosis, pneumonia, and lung cancer. Common respiratory diseases in the Philippines includes the following: asthma, tuberculosis, pneumonia, common cold, emphysema, influenza, lung cancer, bronchitis, carbon monoxide poisoning, and the latest disease in the Philippines, SARS-CoV-2 or Severe Acute Respiratory Syndrome Coronavirus 2. So let's start with asthma. Asthma is a respiratory disease in which certain airways in the lungs could be constricted due to sensitivity to stimulus. Having an asthma sometimes results from having an allergic reaction to dust, dirt, or some pollen. Symptoms of having an asthma includes prolonged exhalation, breathlessness, and wheezing. Next is tuberculosis. Tuberculosis is caused by a bacterium, Mycobacterium tuberculosis. This disease spreads from one person to another through cough and sneezes. Active tuberculosis takes several months of continuous medication to prevent the development of antibiotic resistance. Symptoms include coughing blood, fatigue, fever, weight loss, and loss of appetite. Pneumonia is the swelling of tissues in one or both of the lungs, usually caused by bacterium, but it may also develop due to complications caused by viral infections like chickenpox or measles. Symptoms include cough with yellow, green, or bloody sputum, fever and chills, chest pain, and rapid breathing. Next is common cold. Common cold is the most common upper respiratory tract infections. It is caused by a virus called rhinovirus. Symptoms include sneezing, cough, nasal stuffiness, runny nose or rhinorrhea, and sore throat. Next disease is emphysema. Emphysema occurs when the alveoli in the lungs are destroyed. Turns the alveoli into large irregular pockets with holes in the inner walls. Emphysema reduces the surface area of the lungs. The main cause of this disease is the exposure to irritants like cigarette smoking and air pollution. People having emphysema experiences shortness in breath, fast heartbeat, and decrease in mental alertness. Next, influenza. Influenza is commonly known as flu. It is caused by a viral infection known as influenza A and influenza B. Influenza can be dangerous to infants, older adults, and people with chronic diseases. Symptoms of having influenza include fever, body ache, chills, headache, muscle pain, fatigue, and runny nose. Lung cancer. Lung cancer is the cancer that develops in the lungs. It typically starts in the cells lining of the bronchi and parts of the lungs, such as bronchioles or alveoli. Symptoms of lung cancer are nagging cough, shortness of breath, chest pain, hoarseness, and weight loss. Next common respiratory diseases in the Philippines is bronchitis. Bronchitis is the inflammation of the linings of your bronchial tubes, which carry air to and from your lungs. Bronchitis may be either acute or chronic. Person who have bronchitis experiences the following symptoms: cough, production of mucus, fatigue, shortness of breath, slight fever, chills, and chest discomfort. Okay, so we are down to the last two common respiratory diseases in the Philippines. Next is the carbon monoxide poisoning. Carbon monoxide poisoning results from the inhalation of carbon monoxide. Carbon monoxide is formed by the incomplete burning of carbons in the fuel such as gasoline and coal. When carbon monoxide is inhaled, it combines with hemoglobin. When this happens, the blood will not be able to carry oxygen to the cell, resulting to asphyxiation. Okay, so the last common respiratory diseases in the Philippines that have been recently found this year is the SARS-CoV-2. SARS-CoV-2 is an infectious disease caused by a newly discovered coronavirus. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. SARS-CoV-2 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly falls on the floors or surfaces. Symptoms of SARS-CoV-2 is divided into 3. Most common is fever, dry cough, and tiredness. Less common symptoms includes aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, rashes on skin. Serious symptoms include difficulty in breathing or shortness of breath, chest pain or pressure, loss of speech or movement. So that's the common respiratory diseases in the Philippines. Again, the common respiratory diseases in the Philippines includes asthma, tuberculosis, pneumonia, common cold, emphysema, influenza, lung cancer, bronchitis, carbon monoxide poisoning, and SARS-CoV-2. Now that we are done discussing the diseases encountered by the cardiorespiratory system, we will move to the part 2 of this episode, which is all about how to take care of the cardiovascular system and the respiratory system. Let's proceed now to the part 2 of this episode, which is all about how to take care of your cardiorespiratory system. First, let's tackle on how these diseases could be detected, or the previous diseases discussed were detected. Some diagnostic tools are used to detect circulatory and respiratory diseases. The following are the tools used. First, chest X-ray. It is a non-invasive and painless diagnosis of the respiratory and circulatory ailments. Chest X-ray creates a picture of the structure inside your chest like lungs, heart, and blood vessels. Second, computerized tomography scan or the CT scan. It provides cross-sectional views of the internal organs that give more information than X-ray. Third, blood pressure test. This test measures the pressure in your arteries as your heart pumps blood into them. Next is CBC or complete blood count. It is used to evaluate overall health and to detect a wide range of disorders. CBC measures several components of the blood like RBC or the red blood cells, WBC, white blood cells, platelets, hemoglobin, and hematocrit. Next detection tools used is the electrocardiogram or the ECG. This tool records electric signals as they travel to your heart. Next, cardiac catheterization. Procedure to diagnose and treat circulatory ailments. And the last one is the echocardiogram. Echocardiogram uses sound waves to produce images of the heart. It shows how heart beats and pumps blood. Now let's proceed to the prevention of those diseases. First, no smoking, no vaping. Smoking leads to the development of respiratory ailments. People who smoke die earlier than those who don't smoke. Next prevention, avoid passive smoking or the second-hand smoking. Second-hand smoking has harmful effects in the respiratory system. Since cigarettes have many chemicals that can damage your respiratory tract, avoid respiratory irritants. People are advised respiratory to avoid smoking fumes from cars, certain perfumes, dust, animals' fur, and pollens. If you have asthma, these irritants may trigger it. To protect from respiratory irritants, persons should cover their nose in places that are polluted and have respiratory irritants. Next prevention, exercise regularly. Nothing beats having an exercise regularly. It helps increase your lung capacity and improve your heart muscle. Exercise helps to maintain a healthy weight that prevents from high risk of heart disease by burning lots of calories and fats that may be accumulating in the arteries of your heart. Next prevention, protect yourself from cold air. Cold air can cause contractions in the bronchial passages, making it difficult to breathe. People are advised to wear a scarf or mask to cover mouth and nose to warm air that enters the body. Keep a healthy diet. Avoid too much saturated fats and cholesterol in your diet, as this will narrow the arteries. Control your salt intake because it can raise high blood pressure. It is advisable to eat lean meats, beans, fish, plenty of fruits and vegetables, and food rich in iron. Avoid respiratory infections. Avoid people who have flu or cold. Always wash your hand and carry a small bottle of alcohol to kill germs. Other prevention of avoiding these respiratory infections is having a vaccination. So that's end the part 1 and the part 2 of our episode for today. Part 1, which is all about the diseases encountered by the cardiovascular system and the respiratory system. And the part 2, which is all about taking care of cardiovascular system and the respiratory system. But before we say goodbye, let's have a reflection first. People nowadays are getting more careless. They don't care on what they do. They don't care on what they buy or sell, and sometimes on what they say. Most of it, they don't care on what will happen to themselves. They tend to eat out of diet or work beyond limit. They sacrifice their health over money or pleasure. But let's be reminded that everything that we do is not permanent. We are not healthy for forever. We get sick, we get tired. We must remember that everything we do affects our health. We must be accountable for ourselves and respect, as well as to other people, especially the professional persons. If your doctor or physician tells you that to take that medicine 3 times a day after every meal for 10 days, you must follow it, even you feel that you are already okay. Doctors don't tell you that to waste money, or they only want to avoid getting more complications or the risk getting your disease or infections immunized to the medicine you are taking. So be responsible, accountable, and respectful person. Okay, so time to say goodbye. This is the Scientific Mind with Sir Eman. See you on next episode.